So, good morning, everybody. And before we start today, I do appreciate all these presidents. I'm honored to be around them. It's not like in high school when I was on the other side of the desk getting in trouble. But it's nice to be in a partnership than the other way I used to have it with Mayor Jennings. But anyway, it's been tough. It's 316 days, 45 weeks later, and sadly, we lost 5 more Albany County residents last night. A woman in her 50s, 2 men in their 60s, a man in his 80s, and a woman in her 90s. My condolences and prayers go out to the families. It's a difficult time, and I keep hoping I don't have to say this. To lose anyone under any other way is still difficult, but to lose someone to COVID-19 and to what's going on around us is so difficult. And remember, in the beginning, you couldn't have a proper burial. It's still different the way we do it, limited how many people can come in. So please take the time, think of these families and think of their loved ones, and my condolences and prayers. Unfortunately, that brings 291 people that have come to COVID-19 in this county since the outbreak started. There's now 65 people that have passed away from COVID-19. If we remember, December, 9 months ago, was our deadliest month yet in the county at 66. We have 9 more days left to this calendar. I was hoping I was wrong when I said this, and I sat here with Dr. Whalen and we talked about it, and we said this November was going to be tough, December was going to be deadly, and I said January is going to be the deadliest calendar for us going forward since it started. I was hoping I was wrong. I was hoping the TU was going to write, Dan McCoy's wrong. I was hoping the Troy Record, the Gazette, Altamont Enterprise, I'm wrong, and I wasn't. I don't take solace in that. I take remorse, and it's not easy. And COVID-19's here. Didn't go away. It's not going away. It's not done with us. So please stay vigilant. Please do the right thing, and we can get through this. As of today, there's 16,744 cases of COVID-19. Today we have 255 positive cases since yesterday. Our 5-day average is 213 per day. It was 206 before that. There are currently 2,888 people that are under mandatory quarantine. The day before was 2,934. Of the new cases, 40 have a close contact, 18 are healthcare workers, 1 reported out-of-state travel, 196 don't have a clear source of infection at this time. As of today, 49,567 people have completed quarantine. 14,991 of them were positive and have recovered, which is good numbers. That's an increase of 283 recoveries since yesterday. Unfortunately, the thing we've been watching here, and we set up with St. Peter's Partnership, the hospital at our old nursing home, at our Shaker Place rehabilitation, it's ready to go. Everything's in place. And hopefully we never have to have a patient go through that door. Based on hospitalizations, we had 22 new people hospitalized in Albany County overnight. We have now currently 168 people currently hospitalized from the virus. It was 170 yesterday, 13 people in the ICU, and the number today is 13 people in the ICU. Hospitalization beds are 25%. That's been staying stable. Beginning of the month, we were like 24, and now we're like 25, so that's good. Dr. Reed and his team get briefings every day of where the hospital bed's at for everything going on. 19% has stayed the average for the ICUs. That has not changed. So, we're still roughly worried about ICU beds and watching that. Please do your part. Please wear your mask, cough into your arm, clean your hands, and stay 6 feet apart, and we'll get through this. The vaccine's here. It's rolling out. We have the demand. We just don't have the supply. I'm hoping the new president starts the Defense Act and gets mass production of this vaccine going out. But it's going to take time. And you have to wait your time. You have to wait for your category. I know you want it, and I say thank you to the people that want to get this. But let's get it into the arms of people that need it first and foremost so we can move forward in an easy way. For those who want to get the vaccine, check their eligibility. Please contact 1-833-697-4829. We did the partnership with United Way. I just had a meeting with our Black Caucus led by Bill Clay, our chair. Bill, thank you. Andrew Joyce, our chair of the Ledge. Great partnerships. And we talked about the 211. Anyone can use it. It's just not for Albany County. It's just not for the Capital District. It's for the whole state of New York. It's simple, people. I know how hard people are having a hard time going online. Oh, maybe these professors can help us here. These presidents, I should say. People are having a hard time navigating the web. They're having a hard time figuring out where they go to get it, where if they're eligible. What number do you call? Waiting 2 hours on the phone and then being hung up on because their spouse or their loved one couldn't get to the phone and they canceled their appointment, said they have to talk to them. I know about the frustration, and I can't address that. That's on the state. State can. I cannot, but I can address this. 211. Call it. We'll simplify the process. We had a huge success with our pod yesterday, and over 800, or we had 800 people go through the Times Union Center. Dr. Whalen and her team, thank you. They did an outstanding job and got people through. Nothing but good rapport back from people, and they were happy about it. We normally had our website go through Albany Meds. We are no longer doing that. We are breaking away. We're doing our own website. Our next pods and our future pods are going to be controlled by us, and they're going to say why. We need to get vaccine into the arms of people that need them. We need to do 20% teachers, 20% grocery workers, 20% essential workers. We need to break it up and get it into the people that need it, and we can't control it when it becomes kind of like the Hunger Games. Who can get their appointment quick enough? Who's savvy with the computer? I got chubby little fingers, I can tell you. I have a hard enough time texting, let alone trying to get on the computer and using a keypad. I get it. We're going to simplify it, and we're going to make sure it gets. We need to get more Black and brown community members signed up. We need to reach out to them. We had a list. We established a list. We were going to go forward, but they took the 65 and above away from us and told us we have to concentrate. But I have to make sure this gets to the most vulnerable population in the county and the state of New York. And we're not doing that. We're failing that community. Bill Clay and the Black Caucus was correct yesterday. We are failing. We need to make sure we get to them. That's why I did that signature move with Mohawk Ambulance. They're ready. Hopefully they're going to get the visor and the other supply from the state this week, and we will come to your doorstep. We will come to your doorstep. Brendan Lyons did a great story today in the Times Union about people with disabilities. I have said this. Everyone goes, must be a nice power you have, and you can do all these great things. Didn't get my mother a shot. Didn't get my brother a shot. They qualified. And you know what I got to live with today? My brother's in the hospital with COVID-19. Knowing if I got him that shot 2 weeks ago, would he be there? Would he be there? So I will say to everyone, please wait your time. Let the people get it that need to get it. But we need to take care of all the people with disabilities that are home or in group settings that can't get out. And we haven't addressed that on the state level, and we need to address it. It's a great story. Read it, please. I had a great Zoom meeting with Harry last night. We talked about working in partnerships. Thank you. It was great. To the mayor, I don't want to throw you in. You can't go to Florida. We'll turn you into the state. He was talking about going out of Florida. We're like, Larry, I'm sorry, I didn't mean to say his name. But you shouldn't go to Florida or you're going to have to quarantine, and we're going to make sure that you quarantine. But when you talk about partnerships and working together, it's not Republican, Dem, conservative. It's us working for the people and putting everything else aside. And one of the best fabrics of our community here in Albany County, and I love to say this, is our universities. They are the ones that keep us moving. And I know neighbors get aggravated at times, and people get mad when the college kids are back or have a party or something like that, because I know people forget what it was like to be a kid. But again, they're the ones that keep a lot of things, a lot of businesses in play here in Albany County. A lot of restaurants open, a lot of little five and dime stores on the street corners, or the pizzerias, you name it. Parents coming to visit to stay at hotels, taking their kids out to a restaurant. Graduations, it has a huge impact on our community, not just on that university. And we have the best, and obviously I'm surrounded with them. Where were you when I was trying to go to school? I can't be prouder to be sitting here with the president, Javier Rodriguez, from the University of Albany, Marshall White, acting president of St. Rose, and Colonel Gibson, which I like to call him. You know he's a former congressman. I won't hold that against you, but I do like the fact that you're a colonel and leading our way as president at Siena College. 3 great colleges. We got Maria, we got Sage, we got some of the best places here that keep us moving. And so one of the things we do want to talk about, kids are coming back, some are virtual, when they're starting, the protocols they put in place. It was a learning lesson for everyone last year. And the education that the three of you have to do for the new freshmen coming in that are going to be challenging, but hopefully the sophomores have it now and the juniors and the seniors, and how graduation's going to look and how it's going to look coming back to the campus. So, again, I want to thank all of them for taking the time out of their busy schedules to be here to talk to us. And I do want to start with President White. You started the spring semester early this week, and St. Rose's classes are all virtual. Mm-hmm. So if you want to talk about that, that'd be great.
Thank you. Good morning, and I'm very excited. I want to thank you, County Executive Dan McCoy, for inviting me to join my partners here, Dr. Rodriguez, Dr. Gibson, and I'm Nurse Marcia White. So I think we have everything covered here. You know, these are incredibly difficult times, and they call for very incredibly difficult decisions, and our county executive have done it. He's done it through facts, he's done it using science, but he's always putting the people of Albany County first. And we all owe a tremendous debt of gratitude and profound appreciation to you, to Dr. Whalen, for all the effort and all the important information you share with us on a daily basis. And the college, as you said, Dan, the College of St. Rose, we are proud to be a campus within this city. You know, we have no walls. Our sidewalks are the city sidewalks. We're a very integral part of this city and the Pine Hills neighborhood, and we have been for 100 years. We continue to be proud of this neighborhood, and we provide this region with educators, with social workers, with counselors, with speech therapists. These are people working very, very hard to serve their dear neighbor, and by helping them navigate during these very challenging times. But to get it done, you need two things. You need faith, and you need a strong plan. At St. Rose and at this county, we have both. We work closely with Albany County, and we've never worked closer than we have over these last 10 months. I know that Dan and his family have a very close relationship with the College of St. Rose. They've been part of the foundation in the future. He's got many relatives that have attended St. Rose, and again, they're out there helping our community get through this. And the daily Albany press conferences are basically part of our morning schedule. The information that we get, the data driven here this morning, helps us guide our decision making and informs our planning. And I'm very grateful for you, for your staff, for giving that to us in such a timely, important way. When we saw 21.1 million COVID cases and 375,000 deaths in this country, I also saw 12203 on the headlines. Well, the College of St. Rose is in 12203. And when we read that our neighbors were facing record-breaking infection rates, and there was no sign of slowing, we knew that we had to pivot. Now, pivot is the operative word that higher education has probably used for the first time in 2020. It's a word they're going to have to get used to and use it often, because we look at it and use it every single day. So we made a decision that on January 19th, our students would return to class remotely rather than in person. And we will continue that remote learning for the next 2 weeks. In-person and hybrid teaching will begin on February 1st. And that hybrid is a combination of in-person and remote. When we decided to, earlier this month, to move the class schedule, we decided that we would also offer some of our college students the flexibility of moving back to campus while they were remote learning. The reason is some of our students do best at campus, where they have greater access to technology, they have fewer distractions, and the ability to focus that sometimes is not possible at home. So we also have given the students from areas outside New York, those in travel advisories, some of them have returned early, but they are also quarantined to following the proper protocol. Just over about a third of our students living on campus have returned early. We expect close to 900, maybe a few more students that will come back to housing for the spring semester. And the last group of students will move in January 30th and 31st, unless we pivot. Last semester, we required all students who lived in residence hall to be tested before they moved in. We're doing it again this year. We're also having all employees tested as well. And our men's and women's basketball teams started a preseason this week. However, they're being tested 3 times a week thanks to our partnership with University of Albany's RNA Institute in full compliance with the NCAA protocol. Our partnership with University of Albany is making this possible, and it's a hallmark of collaboration between our 2 institutions, less than a mile apart. As a member of the NCAA, the Northeastern 10 Conference, the conference member presidents meet frequently, and we're waiting until the first week in February before we commit to intercollegiate competition for men's and women's basketball. The plan is for women's volleyball to begin preseason on the second week of February. We'll make the decision on spring sports, basketball, softball, women's and men's lacrosse, track later in February. Our intercollegiate esports team continues to be competitive in tournaments. Throughout the semester, we'll spread our repeat protocol of weekly testing. Our on-campus population, we also plan to increase our testing significantly this year. Students and employees are still required to file their daily screening, their health screening form, and all the COVID-19 prevention policies will continue to be in place. Wearing masks on campus, including outdoors, social distancing, restricting the size of in-person gatherings, no guests on campus, and students must remain in their own residence halls. St. Rose is a community-minded institution, and one of our founding values, the Sisters of St. Joseph of Carondelet, is caring for our dear neighbor. We're proud of our students. They have become our champions in this war against COVID, and they are a blessing to all of us. Our student organizations have also increased the job providing virtual and safe in-person programming last semester in order to maintain community, and the Student Event Board won a national award for their efforts. So I want to give you just a little history here. Since August 24th in 2020, we only had 73 positive test results out of approximately 2,800 undergraduates and graduate students, and 730 full and part-time employees. Prior to Thanksgiving, we had 21 positive cases, total since the start of the fall semester. Since the start of the spring semester on Tuesday, we've had a total of 13 positive tests, some students and employees. We asked all students and employees to inform us of their tests, whether it's positive or negative, and we've reported all on our dashboard. Only those with negative test results are allowed back on campus, and their ID is only turned on to active status given the card access when the results is negative. So our spring semester return to campus plan has been developed to ensure a safe return to the campus of our students and our staff, and an important goal is to reduce the risk of community transmission of COVID-19 within the St. Rose community. So thank you very much, and thank you, Dan, and again, you're a blessing to all of us.
Thank you, President Marshall White, and for your leadership at St. Rose and in the community, because you are a fabric of our community.
Thank
and my family has enjoyed your college. So, talking about partnerships, Dr. Rodriguez, and I have to say that you are my favorite president since I've been in this job in 9 years, and that says a lot. Not
really?
Even before, well, my favorite at UAlbany. My favorite at UAlbany. Let me clarify that. This favorite at UAlbany.
No wonder you couldn't get in St. Rose. That's like, now I know. All right, thank you.
Favorite at UAlbany,
move my
boy.
chair.
You know, I know Mary's sitting there going, "Don't say it, don't say
All
it."
right. Okay.
But no, I just working with you since you've been here, and really how you got into the community and really got involved with everything and every issue that's been thrown at us. Thank you. And to Chancellor Malatras, because when the governor's done making him do everything else, and he's still extraordinary, doing great leadership as chancellor, the things he's going to do on top of that when he's completely focused on that. It's great partnerships, and that's what it takes in the community. But I'm going to let it go with that before I get in trouble. So, Dr. Rodriguez.
Thank you, Dan. That's how people get in trouble, right? It is really an honor and a pleasure to be here. First and foremost, Happy New Year to everyone. I hope that your 2021 is a safe and healthy new year. Thank you to Dan McCoy for County Executive for the invitation. It's an honor, really a true pleasure to be here with my friends and colleagues, Presidents White and Gibson. We deeply appreciate the strong work, active engagement, continuous work, day in and day out, that Albany County and the Albany County Department of Health have continued to engage in under the leadership of Dan McCoy to deal and focus on this pandemic. Really, truly excellent work. And so our appreciation, deep appreciation, goes to you, because we all know that this effort truly requires all hands on deck. And our regional partnerships are really critical to our collective success. Throughout this crisis, the University at Albany continues with its strong commitment to engagement and service, serve our communities. We've been from manufacturing face shields and distributing it throughout the capital region, through hosting a testing site, to developing our research on COVID-19 and the disproportionate impacts on communities of color. And of course, recently, the next logical step was to establish a vaccination site from the state here on our campus, and we were delighted to do that. The university has been planning for months the start of the spring semester with safety and health as a paramount importance for our community, for our faculty, staff, and students, both internal and external community. Nearly a year of dealing with this pandemic has provided valuable lessons about what works and what does not work. We've made changes based on that information. Given that we are the largest institution of higher education in the region, and because our testing on campus is ongoing, we test everybody that comes to campus on a weekly basis. So faculty, staff, and students, you come to campus, you get tested weekly. So as a consequence of that, we also see cases that evolve here at our institution. But just to give you an idea, since September 1, we have conducted internally over 45,000 tests at our university, and we have a positivity rate of less than 1%, right? So that is quite amazing, and that's a great result of our faculty, staff, and students following our guidance and instructions. The constant testing also allows us to monitor any asymptomatic spread, and we take any necessary actions as precautions very quickly. Just at the end of the fall semester last year, we saw a spike. As a consequence of our testing, we decided to go on pause, and we did that thanks to the great work conducted by our RNA Institute and the School of Public Health. We're expecting about 3,800 students to come back to the university, to our apartment and residence halls. So we are at an occupancy rate of about 50%, which from a public health stance is really good for physical distancing, if you will. Last fall, we decided to delay the beginning of the spring semester. So we are starting on February 1, which is 10 days later than we typically start, just to see how things transpire with COVID and the flu season and things of that nature. Given that we will not have a spring break, classes will end on time on May 15. The mix of courses this spring semester will be very similar to the fall semester. Approximately 62% will be remote, 9% will be hybrid, and 29% will be in person. But the in-person courses are typically very small courses, so the total percentage of seats that will be remote will be nearly 85%. So nearly 85% of our instructional seats will be online. All of the safety precautions we established in the fall have been expanded and improved for the spring semester. Everybody's required to have mandatory testing all students prior to coming to campus and show a negative COVID-19 test. Within the first week or so, everybody, again, will be tested when they arrive on campus. We have developed the capacity at UAlbany through our RNA Institute to test as many as 2,500 students, faculty, and staff a day. 2,500 tests a day. Not that we will do 2,500, but we do have that capacity and are working with partners such as St. Rose to also do additional testing. All students, faculty, and staff on campus for any reason, as I said before, will be required to participate in weekly surveillance testing, and that is critical. And if we decide to do any surge testing, they will also need to participate in those. We will expand and have expanded testing kit distributions to Midtown Albany so that we can make sure that students that are not on campus also have access to these tests and get tested as well. We just developed a new, and we're excited about this, a new automated surveillance follow-up system to ensure compliance and testing, so that if somebody does not get their test when they were required to, there'll be an automatic surveillance system that will say you have not tested and this is what you need to do. We've expanded our student support team and contact tracing capabilities, so we have a dozen Bloomberg-trained contact tracers to assist Albany County as necessary. We've expanded our isolation and quarantine housing to about 337 rooms, and we're now doing all quarantine and isolation on campus. So we are in full control of our isolation and quarantine rooms, and we have revamped and enhanced our COVID-19 tracking dashboard website, which will go live on Monday, and you'll see a lot of good information there as well. In addition to the day-to-day operations, we continue to work closely with the Albany County Department of Health to plan for vaccine distribution to our broader campus population in the event that there is sufficient supply prior to the end of the spring semester. Again, we're working very closely with SUNY and our Chancellor, Jim Malatras, who has done a phenomenal work across the state to engage all SUNY universities and really being with a keen focus on health, safety, testing, vaccination, etc. So this is where we are, and we'll be happy to answer any questions later on. Thank you, Dan.
President, thank you. And again, thank you for the partnership and the leadership at UAlbany for everything that you're doing in the community. And President Gibson, where are you? Hey. So, Colonel, like I like to call you, and you've worn many hats and obviously deployed multiple times. And I have equated this as a mobilization, in my view, of what we're dealing with and how it changes, because the virus changes, how you deal with the workplace or a university is constantly changing with everything else, and I know you've been on top of this. I was impressed when I went there with Supervisor Paul in my hand. My deputy, Dan Lynch, walked away, and I'm like, I didn't expect anything less than the battle plan that you put out in front of us that day. And I want to say it has been a great partnership with your school too, and as well as all the universities here in Albany. And maybe as as a peace offering as we move forward for unity and a partnership, maybe we can get the two colleges to play basketball, just, televise it at the times union, kind of just, to bring our, and St. Rose, we'll bring you in too. We'll bring St. Rose in too. I love St. Rose, trust me. All right, that's it. We'll bring them all in. How about that? We'll have a little tournament here, and we'll do it at the TU. But President Gibson.
Yeah, thanks very much, Dan. Greatly appreciate your leadership and your team. As Dr. Rodriguez mentioned, this certainly cannot be done alone. We have to work together. We have felt fully supported by you. Your team, DOH, has been a tremendous partner. We're very grateful. Also, you mentioned Paula Mahan. We just want to say from Siena College, the community perspective, how much we appreciate our collaboration with the town of Colony as well, with Paula and her team. Start with that. And then also say, likewise, when it comes to teamwork, it's great to be with my colleagues today and appreciate when we do work together, we share information, we work problems together, and it means so much to us. as we looked at the situation, this threat, the pathogen, coronavirus, one of the first things we did is we looked at this and we looked at it historically, and we took into consideration the pandemic of 1918 to 1920. And among the things that we concluded was that, look, these things come in waves. We were of the mind that we were likely going to see a second wave come around Thanksgiving. History tells us that these last for about 3 months' time. Accordingly, we changed our calendar. So as we approached all of this, we looked to finish our instruction around Thanksgiving, and then we weren't going to start again until February. That's why we are starting a little later. We'll begin our instruction on February 22nd. So fortunately, I do believe that helped us. We were able to start in the fall with this in-person residential experience, this Franciscan education of a lifetime we believe so deeply in. We were able to start and go all the way to the end and accomplish our mission there. So we hope that this adjustment to the calendar also puts us in a strong position to get there. Now, when it talk about the calendar, so we will begin classes February 22nd. We will not take a spring break. We share that with our colleagues, and our final exams will be May 22nd to May 26th. That takes us to commencement. Commencement will be back on campus. I know for a number of years we've had it at the TU Center, but we also believe it's safer being outside. So we're going to bring commencement back to the campus. We're going to have it in the quad, and we'll be in compliance with all federal and state and county guidelines. We look forward to that. As we get ready to bring students back to campus, we have a whole protocol. It's very similar to our colleagues here, and it begins with the requirement that all students have to have a PCR test, not just students, the entire community. So our students, faculty, and staff will all get a PCR test prior to returning. And then in addition to that, like our colleagues, we will do 100% testing when students get on campus. And so we are partnered with the RNA Institute. We really appreciate that. That not only is going to improve the timeline between getting the results, so vitally important, but also, quite frankly, it's cost effective as well. So thank you, Dr. Rod, you and your team. So once we get through the re-entry, we will set the campus and prepare for the semester. So I want to talk about a couple things. One is the residential life, and then also the academic setting. Let me begin by the academic setting. So one of the things that, as Dr. Rod mentioned, we're all learning and growing as we proceed. And so we're going to spread our students out more in the classroom, and we believe that's going to cut down on the number of quarantines. So we'll have at least 6 feet between students in the classroom. Our student body is approximately 3,000, of which approximately 2,100 will be in residency. We'll have about 500 students that are remote. One of the things we were committed to is just working in a radically personal way with every student and allowing them to really be the author of their semester. So we have about 500 students who prefer to be remote, and we say yes to that. And then we have the balance, about 400 or so, who will commute to campus. So 3,000. And mentioned the classroom. Now, what we're going to do is we're going to have a little over 50% of our classes that will start in person. And April 1st, we plan a tent city to go up. And so after about 5 weeks of time into the academic semester, we will then have the opportunity to significantly expand in-person instruction with the use of these tents. So the tents are 40 by 60, and it allows for at least 6 feet separation, in many cases 7 to 8 feet separation, and in a setting. So that this aligns with what we believe the nicer weather will be coming, good to be outside. So we hope to close the semester with perhaps as much as 75% of our classes in person. That's academic. Let's talk about the residential life experience. Like our colleagues, in addition to what we're hoping through the screening process of 2 protocols of testing, we hope to start with a confidence, because we'll also have wastewater as part of our testing. We know that the shedding in the waste, actually, we can get determination 3 to 4 days earlier than we do in a PCR test. So we hope to start from a very green status on campus, and then we're going to have to surveil that. So surveillance will come in a number of ways. One is the wastewater. We have found efficacy in this. We have found that we do get an early warning with the wastewater, and we were curious as to what happens, after somebody recovers. Do you still have efficacy in the wastewater? It appears yes. So this is helpful to us. So we partner with that, with the surveillance, and so we'll be using RNA for surveillance. So our testing will include wastewater, it will include PCR, but it'll also include an elective dimension, which will be antigen. So we have rapid tests, and so we'll be offering those as well. So we think that's really important for both the safety and the perception of safety for our students. And we look forward to implementing that. So in addition, we also do the daily screening, and we think this is goes hand in glove with all of this. And as we go beyond now and look over the horizon, and we anticipate the vaccine proliferation, here's where we are on that. First of all, we have of about the 3,500, now I'm expanding beyond students to include faculty and staff on campus. Above the roughly 3,500 persons in our community, about 500 or so are eligible now, either in 1 Alpha or 1 Bravo. That's in addition to our nursing students, our pre-med students. We also know face-to-face professors and those involved in administration are eligible. So we have had some of our personnel actually get their first shot, and we're continuing to move forward on that. Siena has also volunteered to be a point of distribution. So we've been in consultation with New York State for that and the county. So we look forward to that time when there's enough vaccine out that we can join Albany and be in a point of distribution. So that includes plans to build out and make sure that our students who have compromised immune systems are put towards the front of the line to make sure that we get them vaccinated, and then hopefully, fingers crossed, that there's enough proliferation as we move towards April and May, that the students who are in congregate setting, which is a higher risk, I know that we've all come to agreement on that we'll be prepared to complete that vaccination of our students who are in residential life. So our intent is, while we I really credit our entire community for coming together and allow us to get the mission done in the fall, our hope is to deliver a better experience in the spring. Always working to get better, and that means both in terms of the academic program and the residential life. And so towards that end, a vaccination would really make the difference on that score. So prepared to take any questions, but let me close where I began and just express my gratitude for the leadership here. So vitally important in all times, but particularly in a crisis moment. So Dan, thank you for your leadership at the top, and for my colleagues, for your collegiality, for your real deep sense of mission, and for the way we work together. Thank you.
Thank you. Thank you. And thank you to the three of you. You're all my favorite. And I want to say that, you are a fabric of our community. And the care that you just not take for your staff, for the residents coming in, it's a conversation I had with county executives across the state and county managers as we start to get back to life not being the way it was, because the way life was prior 10 months ago, it's not coming back that way. Things are going to change. But to the parents and to people sending their loved ones to these three great colleges, know that they're doing everything in their power to keep them safe. And that's the most important thing, because it's hard enough as a parent to send your kid off to school, and you worry about every other thing, and now you got to worry about this thing on top of it, and let the parents know there's a game plan in place. It's going to work, and we're going to continue to adjust, and we have to adjust, and we've been adjusting for the 10 months. So what we're talking about today might not apply a week from now, depending on what goes on. But again, thank you for your leadership. I want to remind people, please get to Whitney Young. If you don't have insurance, we pay for it. 518-465-4771. And UAlbany, as always, great partners. Everything they're doing up there, Department of Health, thank you. 188-364-3065. Go to our albanycounty.com to see for testing sites, what the age requirements are, the wait times, all that. I will assure you, too, we will be dropping a new app very shortly. on how you can sign up for to get your vaccine and make it very simple for you in the different sites. We're going to simplify it for you, and we're going to make sure that you can understand it. So again, we're going to make it easy for anyone to navigate, and kind of like we got the idea when we were brainstorming in our office that if we did it for where we can get testing done for COVID-19, why can't we set up it and make it simple that somebody can look at and just walk them through it, or know where the vaccine's available and the wait time. And we'll do the best that we can, because we don't know. We won't know till Saturday what vaccine we're getting for next week. Like this week, we're hoping for like 4,000. We got 800. And Dr. Wellen and her team got all 800 vaccines out yesterday with that issue. I think it took them roughly 4 hours, Mary? Roughly 4 hours to do that many shots, which I commend her and her team. And we're willing to, do 4,000 and get it through the community, hopefully with Mohawk Ambulance, and trying to do a deal right now with St. Peter's Partners on all their shops. So stay tuned for that. And to Crestwood Pharmacy, which got allocation for Pfizer, not through the state. We're going to be partnering with them, and they got roughly 200 vaccines that they'll be getting out. So Jay, thank you. We sat down with them yesterday and talked about that. Again, working together. And remember, the world's different. Take a step back, take a deep breath. Things are different. Wait your time. I know it's hard. I know it's hard on everyone. To the people this hasn't affected, God bless you. Really, I mean that. To the people that think it's made up, I'm glad you're not sick. I seriously mean that. I really do. And I hope it doesn't happen to you, But people are struggling, having a difficult time. Our unemployment's the highest it's ever been for the restaurant workers here in the Capital District. People are out of work. People are going to be devastated as we continue to go forward. Count your blessings and thank God for the stuff around you, and as you move forward, or whoever you believe in, and I don't care who you believe in, just thank that you have a great job, you're an essential employee, and you can put food on your table. So again, to the colleges, thank you. Mental health support is available. It's crucial, not just for adults, for children. Please call. I know children are struggling. I know life's different. Please call 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. As always, they're there. The 24-hour sexual assault hotline, 518-447-7716. 211 now for any questions COVID-19 related. We switch gears. It's anyone in the state can use it. Please, it's simple. It's easy. 211. Call it. We'll help you get through it. The New York State hotline, as always. Please do the right thing. Stay out there, and we'll get through it. And just to put a little thing in the light, since my last press conference on Monday, we've lost 16 county residents in 4 days. Please help us protect the people around us. Wear your mask, cough into your arm, clean your hands, and stay 6 feet apart.